Hello, my name is Dr. Dewan S. Raja. Today I will discuss about apoptosis. What is apoptosis? The apoptosis is a programmed pathway of cell death in which cell activate enzymes that degrade the cell's own nuclear DNA and the cell protein of the nucleus as well as protein of the cytoplasm. How the apoptosis is different from necrosis. In apoptosis, the plasma membrane remain intact but altered. There is no inflammation. Cell size shrink, but in case of necrosis, initially cell size is increased, swelled up, endoplasmic reticulum is swelled up, mitochondria is swelled up. Here, in case of apoptosis, cell size shrink. And necrosis, always there is inflammation, and that is not a programmed cell death, that is always pathological. Maybe physiological, pathological. Apoptosis may be physiological, like during embryogenesis, organogenesis to the intrauterine life, or the apoptosis of the cell of the intestine, apoptosis of the blood cell, apoptosis of the uterine endometrial cell. Okay, so these all are physiological. Pathological, maybe some type of DNA damage by radiation due to some type of viral infection, like some type of viral hepatitis, may lead to apoptosis, that is pathological. But necrosis is always pathological, that is not a programmed cell death. Necrosis is not a programmed cell death. Apoptotic bodies are engulfed by phagocytes, like macrophages. Okay, what is the mechanism of apoptosis? We'll go through the causes, possible causes and mechanism. Apoptosis occurs in physiologic or in pathologic condition and serves to expel or eliminate potentially harmful cells, and cells those become useless, like that of the some blood cells, lymphocytes, leukocytes. So in this way, it protects us from development of autoimmunity. It also protects us from developing tumor. It also helps in immunological surveillance. Causes of apoptosis in physiologic condition: loss of growth factor signaling, decreased hormone level, loss of survival signals, elimination of potentially harmful lymphocytes. Okay, so causes, and we'll also get one of the mechanism of elimination of harmful lymphocyte. Okay, that is associated with apoptosis. Causes of apoptosis in pathologic condition: DNA damage, maybe due to radiation hazard, collection of disfolded protein in the endoplasmic reticulum, and infection in the endoplasmic reticulum or inside the cytoplasm. Mechanism of apoptosis: two pathway, extrinsic pathway and intrinsic pathway. Intrinsic pathway or mitochondrial pathway. Extrinsic pathway is the death receptor pathway, usually in association with the T lymphocyte. Okay, and but both the way there will be formation of Caspases, that is the chief executioner or intracellular molecular guillotine system that will break down the protein, cut down the protein. So in the intrinsic or mitochondrial pathway, BCL2, BCLX, these are anti-apoptotic protein these are blocked. Bugs and bug pro-apoptotic proteins are stimulated. Cytochrome is released from the mitochondria and activate caspase. Actually, caspases, we have multiple caspases. Okay, caspase 8, caspase 9, like that way. So a series of caspase action. In extrinsic or death receptor pathway, activated T lymphocyte has fast ligand and cell membrane has tumor necrotic factor receptor. So this ligand and this receptor interact, that will stimulate the formation of adaptor protein, and that activates caspase and the caspase reaction, caspases. What are caspases? They are aspartate specific cysteine proteases. They break down cytoskeleton and activate endonucleases. How the apoptotic cells and their fragments are cleared by phagocytosis. Cell membrane phospholipid is altered, its location is changed, and this gives an idea eat me signal to the phagocytic cells. So phagocytic cell will very promptly engulf the apoptotic bodies or fragments, and even without significant release of the intercellular enzyme, without any inflammatory substance significantly. So it will engulf the apoptotic body very quickly. Clearance is prompt and without any signs of inflammation. Okay, here is the apoptosis, normal cell. What happened? Condensation of chromatin. And there will be membrane bleb formation. And this bleb will separate out with membrane. Cell membrane should be always intact. So there is no inflammation. Nothing is released in the surrounding of this cell. Okay. And if it is released, it is very, very insignificant. That does not cause inflammation. There will be phagocytosis by macrophages because there will be change in the cell membrane. The phospholipid will be changed. That will give the eat me signal. So phagocytosis will eat those things. We have mitochondrial intrinsic pathway. What happened? Cell injury, growth factor withdrawal, DNA damage by radiation, toxin-free radicals, protein misfolding. In endoplasmic reticulum stress, there will be sensors here inside the cell, BH3 sensor, okay, that will work on the bugs and bug proteins that will release the cytochrome. These are regulated by BCL, BCX. These are blocked. These are stimulated. So there will be release of cytochrome C. That will lead to formation of caspase activation. And caspase activation is also done by the extrinsic pathway, like receptor ligand interaction. This is the TNF receptor. We have the ligand. That ligand usually present on the cell membrane of T lymphocyte. There will be interaction, adaptor protein formation, again caspase activation, series of caspase activation. It will break down cytoskeleton because it cut down the the protein, and it will also, this caspase will also stimulate endonuclease activation. There will be bleb formation surrounded by the cell membrane, and there will be change in the cell membrane. So it will be easily phagocytosed by macrophage or other surrounding phagocytes. And that's all about the pathology of apoptosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice day. Bye now.